Now I want to really talk about how you can figure out the difference between skeletal, cardiac, and smooth muscle when you're looking at a histology slide, right? Because in a textbook, it looks fairly easy to sort of figure it out. But remember, when you're looking at histology, it can look a little bit hodgepodgey and it can be a bit tricky. So the method I use is you have to ask yourself some very specific questions. The first thing you want to ask yourself is how many nuclei are present. Now, if there are one or two nuclei, that's going to be the difference between cardiac and smooth versus skeletal, because we know multiple nuclei means that it's skeletal muscle, and if it's one or two nuclei, you're going to have to ask yourself, is it striated? Because then that's going to be the distinguishing factor between cardiac and smooth, right? So if it is striated, then we know it's cardiac. If it's not striated, then obviously we know it's smooth muscle. So let's give it a go on this next slide. So this is the histology slide you have. You have to figure out if it is cardiac, smooth, or skeletal muscle. So the first thing, again, you're asking yourself is how many nuclei are present and how many do you see? Do you see multiple or do you see one or two per muscle tissue? So this might look a bit tricky, but for the most part, there are actually just one or two nuclei, right, that are present. And you'll see the distinct difference once you see skeletal. The nuclei also are in the very periphery and they're not as bold looking. So that's something to remember. Now, we figured out that it's just one or two nuclei. And so now we have to go, well, is it striated? And yes, it is striated. So now we know it's got to be cardiac muscle, right? Now, obviously, you can just look at the striations and skip the nuclei and go, okay, now I know it's got to be either skeletal or cardiac, and then figure out, do you see any branched fibers? You know, there are other ways to do it, but I just think this is a simple cheat sheet sort of way to do things.